Hey baddies, and welcome back to my YouTube channel. Today I'm sharing a powerful story and a deep dive into PCOS, also known as polycystic ovary syndrome. We're going to talk about the effects it can have on your skin, your body, and your self-care. You're also about to watch an underarm extraction on one of my long-term clients who's been with me since 2022, and I'm going to walk you through why consistency is key, especially when you've got PCOS. Now, you're probably wondering, what is PCOS? PCOS is one of the most common hormonal disorders in women right now, and it affects about 1 in 10 women globally. And it's way more than just about periods or fertility. It's a hormonal condition that can actually show up on your skin, especially in places like this, on your underarms, inner thighs, and even your face. Women with PCOS often deal with high testosterone, insulin resistance, and inflammation. And all of that can lead to stubborn ingrowns like this, and dark marks and textured skin. Now, what you'll be seeing today in my client's skin is a buildup of congested follicles, but also tunneling, which happens when ingrown hairs curl underneath the skin and creates a little or big pathway. You'll notice the texture looks raised in some areas and dented in others, and that's not just scarring. It's actually inflammation from repeated trauma. In my client's case, one of those traumas is actually from her deodorant. She's been using a spray deodorant far too close to the skin, sometimes literally 1 or 2 centimeters away, and it's packed with all of that aluminium. I've been telling her to switch it to an aluminium-free formula for months now. That constant irritation from the wrong products, combined with sweating, is making her armpits flare up even more. On top of that, her PCOS causes her skin to produce more keratin and sebum, which clogs the follicles faster than usual. So when you layer that with irritation and the products build up, the skin goes into survival mode, and you end up with the thickened, textured appearance and stubborn ingrowns. So now the goal is to calm the skin and support it long term. Now, to truly support her skin goals, let's talk about some essentials from our sponsor, Body Beauty, that I recommend to all my clients dealing with hyperpigmentation, texture, or intimate irritation. First things first, we have our dry brush. Dry brushing is a game changer. If you haven't started, get on it now. It promotes blood flow, removes dead skin cells, and helps prevent ingrown hairs, and regular use can lead to a smoother, more even skin tone. We also have pure natural kojic acid soap, perfect for areas prone to discoloration like underarms, bikini lines, face, anywhere, you name it. And it gently exfoliates and purifies the skin without stripping it. All these products are designed to elevate your skincare routine. Scan the QR code on the screen and grab yours today. Now let's get back into the video. Now, there's 4 types of PCOS that many people don't know about. Let's break them down real quick. Number 1 is insulin resistance PCOS. Now, this is the most common type. It's when your body struggles to use insulin properly, so your insulin levels get too high, which then triggers your ovaries to produce more testosterone, and that's where the real drama starts. Oily skin, acne, excessive hair, stubborn ingrowns. This is what my client today feels like she has. A lot of clients I see with this type also deal with dark marks in friction areas like the underarms or inner thighs. And it's because of insulin resistance. This can lead to darkening. And this is also the type where doctors usually prescribe metformin, which helps your body respond to insulin better. Let me know in the comment section if you've heard of this type of PCOS before, or if you go through it yourself. Moving on. Number 2. Postpill PCOS. So this is usually after you stop birth control. This type happens when you come off birth control, especially the pill, but some people's body kind of freak out. Your hormones go through a bit of a withdrawal and your ovaries suddenly start overproducing testosterone again. This can cause flare-ups of acne, delayed or missing periods, mood swings, and even sudden changes in your skin texture. But the big difference here is that this one is temporary. With the right balance of lifestyle support, your body usually settles back into the rhythm within 3 to 6 months. Who would know people could go through this after birth control? Now, number 3, inflammatory PCOS, when inflammation is the root. Now, this one is deeper and sometimes harder to detect. Inflammatory PCOS is when chronic inflammation in your body messes with ovulation and hormone balance. So if you're someone who always feels bloated, tired, has joint pain, or is super sensitive to food, you might have this one. And yes, inflammation impacts the skin too. It can make your skin hypersensitive or even flare up your eczema or acne and slow down healing. So when you get an ingrown, it stays longer or turns into a dark mark. Natural inflammatories like turmeric, ginger, nettle tea will be the perfect powerhouse for this type of PCOS. And the last one, number 4, is adrenal PCOS. Stress is the main trigger of this one. And your ovaries are fine, but your adrenal glands aren't. These are the ones that handle all the stress. They're just pumping out way too much DHEAS, which is an androgen like testosterone. So even though your blood tests might say your testosterone levels are normal, you're still breaking out. You're still losing hair. You're still getting facial hair and you're still having irregular periods. And when your body is in constant fight or flight mode, your skin reflects it. So more oil, more inflammation, and more resistance to healing. So this is a type where emotional and nervous system healing is key. Think less caffeine, more sleep, more magnesium, and deep breathing. When hearing all 4 types, which type of PCOS do you think you relate to? Has any of you guys suffered any of these symptoms before? Now, my client's type leans towards insulin resistance. We've worked on balancing the skin through deep extractions throughout the years, wax maintenance, and recommending a consistent routine. That includes exfoliating, dry brushing, and using post-wax products to soothe and prevent build-up. Now, this is my baddie. She's been coming to me since 2022. And when she started, her underarms had painful ingrowns like you guys have seen. So all the videos I'm showing you, I started from 2022 to 2023, and we're going to get up to present time today, 2025. Even though we do extractions, the work doesn't stop in my salon. She struggles so hard to stay consistent with exfoliation, and I tell her you're going to see the difference between sessions, but she needs to keep it up. As you can see in this session, I think she waited 8 months to come back to me, and then she had all of this build up, and she said she wasn't doing any proper aftercare. So it's quite sad sometimes, but I understand people go through things and people get distracted. But I used this video to show her that you need to look after your skin and prioritize your skin health so much. Now, throughout the years, having a lot of clients that deal with PCOS, I've been able to gather a journal of information, and there are loads of ways to manage PCOS, but it's about finding what works for you. Medications like metformin are prescribed often to lower insulin levels. Others use hormonal birth control, but more of us are turning to holistic options. One of my go-to guides is the Jamaican Herbs and Medicinal Plants and Their Uses by LMH Publishing. It's packed with natural herbs like nettles, which can help support hormonal balance, and other clients drink spearmint tea, known to help lower testosterone naturally. Another interesting fact I found out is that new studies link trauma and chronic stress to PCOS symptoms. So that means even if your hormones are out of balance, the root cause might be emotional or nervous system related. So that might mean daily stress, emotional burnouts, and even feeling unsupported can affect your hormones. So taking care of yourself isn't a luxury, it's necessary healing. Another thing I recommend looking into is Inositol, especially myo-inositol and D-chiro-inositol. These are powerful natural supplements that have been shown to help balance insulin levels and support ovarian functions in people with PCOS. Some of my clients who struggle with irregular periods or mood swings saw some real improvements once they started taking Inositol regularly. But of course, always speak to a health professional. But it's definitely something to research if you're looking for a more natural route. Now, one thing I don't think we talk about enough is how deeply PCOS affects mental health. The hormonal imbalance, the skin struggles, the fatigue, everything. It takes a toll. And some of my clients have opened up about feeling anxious, overwhelmed, or even ashamed of themselves. And let me say this loud and clear. There is no shame. PCOS is a condition. You didn't cause it, but we can manage it together. With support, care, education, and just a little bit of sisterhood. Now, one of the most heartbreaking things about PCOS is how it can affect fertility. And that's something a lot of us are scared to say out loud. I've had so many clients break down because they feel broken or like their body's failing them. And the truth is, infertility doesn't mean impossible. I don't care if your doctor told you, it is not impossible. It just means your journey might take a different path and you are still whole, whether or not you have a baby. Your womanhood isn't defined by your womb. It's defined by your power, your peace, and your purpose. Can I get amen? So let's just take a moment. And let me give you a little reminder today. And say it with me now. I am soft and sacred, even with hormonal acne. I am still that girl. I am still that woman, even with a little chin hair. I'm worthy of rest, even with gut issues and insulin spikes. And I am absolutely still powerful, even while I'm healing my fertility. Like, babes, don't play with yourself. PCOS could never take your glow away, your grace away, or your goals away. Skincare is a big part of what I do, but healing from PCOS is not just about the outside. It's what we drink, the way we breathe, the stress we can hold in our bodies, and that's why I love holistic care. So the bottom line is, PCOS is complex, but you are not powerless. With the right care, support, and education, you can absolutely feel good in your skin and body again. And trust me, this isn't the last PCOS episode I am doing. I've got more coming, client stories, tea recipes, hormonal hacks, you name it. Just make sure you're subscribed and turn on your notifications so you don't miss out. And share any comments in the comment section. Take care, buddies, and stay glowing. Mwah.